Thank you, everybody. Thanks, Taylor. So I want to get you guys to try to imagine home health care in the comfort of your own home. I think we all have either gone to the emergency room or have had bad experiences going to the doctor. The last thing you want to do when you don't feel well or you feel sick is have to pick yourself up off the couch or out of your bed and actually go to an emergency room or to a hospital, right? Everybody's had that experience. Imagine you're a mother of 3 and you have to do that, or you're elderly care and you have to get up and get out. Everybody has had their own sort of personal experiences. I'm one of those people that feels like I'm getting sicker just by being at the emergency room of the doctor, right? So I have 2 children, and there's nothing funnier than watching my wife go into lockdown mode when we walk right about when we're walking into the pediatrician's office. Her warnings to my 2 children not to touch anything. She's like, I mean, literally, she becomes like a hockey goalie. Like, if they start to touch a book, she's like diving and like grabbing them away from it. It becomes like that important. It's a miserable experience. So, and we've all been there, right? So, do you guys know? So, there's 1.2 billion hours in waiting rooms wasted every year in emergency rooms. $38 billion spent unnecessarily on health care through emergency care. 71% of emergency room visits could have been handled in primary care. So the gentleman that I'm going to introduce you to and his company are trying to solve that. But it doesn't just stop there. It's not just the unpleasant experience. It's also an understanding of what things cost, understanding your health care. I'm actually in the health field, and I still defer to my wife. She's the one that has to figure out what gets paid for, what's covered, what's not. So having exposure, I think, is also a key piece to understanding where your health care is and what is a good visit, what's not, what's in your plan and what's not. So I think that's really important. So times are changing, right? As we're all becoming more responsible for our own health, I think it's important that we all not only have exposure, but an understanding of what our needs are and what things cost. There's nothing worse than that surprise of, oh my God, that visit cost that, and maybe you didn't even need that visit. So we're seeing entrepreneurs in technology and healthcare really trying to change the world. And if you think it's difficult being an entrepreneur, try being an entrepreneur in the healthcare field. I mean, you're trying to not only innovate, but you're really trying to create a cultural change and a shift. Very difficult. So I'm going to introduce you to Thompson. I wish Taylor helped me with his last name. Aderinkomi. So he's the founder of Retrace Health. Retrace tagline is like having a doctor in your family with affordable, convenient, and predictable video-based in-home primary care. Basically, it's a doctor on-demand service. When you hear and meet Thompson in a few seconds, I encourage you to listen. This guy has an incredible story, but he's also going to take you behind the mind of an entrepreneur, how an entrepreneur thinks, the hurdles that they go through. I mean, his story reads like a movie script, basically. And that's really everybody's story. So I encourage you to think about your own story when you're listening to Thompson and, what problem you could solve or where you think this can go. We all have to take responsibility for our own health, and I think it's important to have entrepreneurs like Thompson really changing the system. So here is Thompson, founder of Retrace Health.
Thanks for having me. And like Rich's wife, I'm also a germaphobe. I was at a conference for doctors about in 2009. I was in the bathroom, and I was washing my hands, and this guy walks in, and he looks at me, and I'm still washing my hands. And he looks at me again, and yes, I'm still washing my hands. And he's like, that's good technique. And he's like, where did you study as an infectious disease doc? And I was like, no, I just like to wash my hands very well. And he was just very impressed with my hand washing technique. And I think a lot about healthcare. Just like I think about germs all the time. There's germs everywhere, and they're out to get us. And people don't realize that the healthcare system is also like that. The healthcare system is out to get us. It consumes 18% of our GDP. Imagine just taking 18% of your paycheck every 2 weeks and just throwing it in the river or burying it underground. That's what this country is doing today. And we're doing the same thing with time. Time, that precious commodity of which we all have the same amount. People are just throwing it away, driving to the clinic sitting there in a room full of sick people just to have a 2-minute interaction with their doctor. But I'm not going to talk about Retrace Health as much today. I'm going to talk more about my experience as an entrepreneur. I'll start at the beginning. My story's pretty short. So I'm from Minnesota and happy to be here in New York. And I did my K through 12 there, went to college there, did my first graduate degree at the University of Minnesota. And this part of my story is important. I did it under a master's degree in statistics. And what I did for my thesis, my advisor didn't want me to do. Like, he strongly encouraged me not to do it. The rest of the faculty didn't want me to do it. And the reason they didn't want me to do it is because I had proposed taking ancient Greek texts and building an algorithm that could read those texts and tell you who the author was based on the style. And they just didn't think that was a good idea because they were afraid I wouldn't graduate on time or that it wouldn't work or I would fail. But I convinced them that I would do it and I would do it well. And does anyone have a guess like how well the algorithm worked? Anybody? It was 100% accurate. You know, just taking ancient Greek texts. And the main reason they didn't want me to do it is because I didn't know how to read ancient Greek. You know, at the time that I proposed doing it. So I just said, I'll just take ancient Greek. You know, so I took ancient Greek. And this is a really important part of being an entrepreneur, I think, is a lot of people are going to tell you not to do stuff. Like, that's going to be most people's natural reaction. They'll think of all the reasons something won't work, and it's your job as an entrepreneur to figure out why it will work. So fast forward, I worked as an economist for a while, a healthcare economist, and I always made networking a pretty high priority for myself. No matter which company I was at, no matter what projects I was working on, I always thought that it was important to get to know people. And that carried with me through to my second graduate degree. I got an MBA, again at the University of Minnesota. And when I started that program, I was introduced to one of the alumni who's been very instrumental in my career as an entrepreneur. He's also a very successful entrepreneur. He's founded a few companies and had a few exits. And he, despite the fact that my first 2 startups didn't go as planned, he stuck with me. He advised me on the first one, he advised me on the second one, and he's advising me on this one. He's soon to become a board member at Retrace Health. But how did I start Retrace Health? Or like, where did the idea come from for Retrace Health? It came from this story where my son, who was 1 year old at the time, came down with a very aggressive cough and a fever. And his first child for myself and my wife. It was very stressful for us. We didn't know what was going on. And we called the nurse line. They told us to come into the clinic. So naturally, we went into the clinic in the middle of December with 6 inches of snow on the ground, you know, 20 below weather, and they sent us right back home without doing anything. They're like, he'll get over it. Like, it'll be gone in a couple days. And it wasn't gone in a couple days. So we called the nurse line again, and they told us to come in. The same thing happened. They sent us right back home. They're like, just give it a couple more days. This happened a 3rd time. I'm not kidding you. It happened a 3rd time. And then it happened a 4th time, and they finally diagnosed him with what I already knew that he had. And I'm not a doctor, but I could Google the symptoms. It was pneumonia. Like, it was pretty obvious that it was pneumonia. And they diagnosed him with the problem, and that was where the idea came from. The idea came from this notion of, why am I driving to the clinic every single time? Why do I have to sit there in a room full of sick people, and what can I do about it? And so I started doing research and was talking to people all over the country. I started calling different medical clinics and hospitals that were trying different things, and I couldn't find a model that I thought addressed the problems that I had experienced as a consumer. So I started Retrace Health, and I found a clinic to partner with me to launch Retrace Health. So I didn't know anything about providing medical care. I'm not a doctor, so I said I'll partner with a clinic to get this service to the people that need it. And we worked for 6 months with the strategic partner, and a week before launch, everything just fell to pieces. The deal fell apart, they pulled out, we weren't getting along, our missions weren't aligned. So I kind of sunk into this pit of despair. You know, so here I am working on my 3rd startup a week before launch, and it just fell apart right in front of my face. And one of my other advisors, a different advisor now than the one I mentioned before, he looked at me across the table during one of our sessions, and he was like, well, why don't you just do it? And I was like, what do you mean just do it? Like, how do I provide medical care to people in their homes? Like, I know how to do technology, I know how to, you know, architect processes, but how can I just do that? How can you just start something like that? And he looked at me and he's like, you're pretty smart, you'll figure it out. Just do it. You know, so I thought about that for a week, and I did. I just started doing stuff. I started hiring people even though I didn't have any money. I started telling people I could provide medical care even though I didn't have any providers. You know, I started buying medical equipment. I started putting a website together as if the company actually existed, and I just pretended it existed, and that's how I found myself here today with a company that's operational. That's it.
Okay, great. So we're going to ask Thompson a few questions, and then there'll be time if anybody has any questions from the crowd. So whenever I talk to entrepreneurs, to me, the most interesting thing is kind of what you just talked about, which is that journey, right? It's not, things don't, success doesn't happen overnight. Sometimes people are at it for years and years and years, and there's a lot of pitfalls and ups and downs. What was that moment like when you were sort of smacked in the face with this, wow, this actually could work? I'm actually going to go put all my time, energy, resources, money probably into focusing on that. What was that moment like? Was it an aha moment, or was this something that was just really gradual over time, over all these experiences and startups and starts and stops like you were talking about?
I can't speak for all founders, but I would say that there's a lot of fear. I think fear prohibits people from doing things. I read a quote somewhere that said fear is like the greatest disease on this planet, because who knows what good could be achieved if people overcame their fears. And I won't go as far to say that I wasn't afraid. Like, I've been afraid, and I'm actually still afraid today that it's not, I was just telling Joe, like, I feel like a hoax, sometimes, that it's not real. But I would say the times where I feel that this is really going to work, there's two. It's when my team looks at me in the eyes and they say, thank you for starting this company. I mean, for medical providers, this is a big deal, because they're going to provide medical care in a way that they've only dreamed of doing. And the second one is patience. When some of our patients, call us or leave emails or messages, and they thank us for the time or the money we saved or how we shortened the recovery time for a child, it's times like those that I believe that if I can do that over 1 million people, this thing's going to work.
What type of research and background goes into seeing if your idea is already being done, or if there's an opportunity to do this? I know sometimes people start companies because they see somebody doing it and they think they could do it better. Sometimes people start companies because they think there's a hole in the marketplace. What was that process like?
For me, I'd seen a lot of people suffer from analysis paralysis. And being an analyst, by trade, I could see it. People just always want another analysis, always dig down even deeper. So I determined from the beginning that I would start at the same time as I started my research. And I would kind of do them in tandem, because I've just realized that doing analysis is really just searching for excuses not to do something, right, usually for most people. So I started, like I said, I reached out to people across the country, but at the same time I started recruiting medical providers. I started, learning about how to run a clinic. At the same time, I started trying to get people to sign up for this service that I was going to launch.
There's probably a lot of people in this room who are familiar with the analysis by paralysis, some of our clients, but that's another story. You mentioned advisors and mentors. I think it's interesting also, how did you meet these folks? Where did they come to you along the way? What role do they play in your world with Retrace Health on a day-to-day basis?
I think I've been very fortunate with my mentors and advisors in that most of them have come to me, and they heard through the grapevine or through people that Thompson was working on something. So the gentleman that told me to just do it, that I must be smart enough to start a clinic. He heard about what I was doing and he reached out to me. Someone that advised me early on in Retrace Health, she was a former CEO of Minute Clinic, so her input was very valuable. When I reached out to her, I mean, she's a very direct person, and she doesn't answer every email, but she heard what I was doing, and she responded to my email when I asked if I could have a meeting with her. So I would say that it's mostly been at least some second or third degree connection that's enabled me to garner these advisors into myself.
You mentioned how that company and that idea fell through about a week before launch. Have you ever thought about quitting?
Yes. I've definitely thought about quitting, and
Every day, right?
yeah, almost every day. I have a weight set in my basement,
Yeah.
and on times like that, I just go downstairs and pump some iron, to just get it out of my system. And usually it's an investor that says something to me that I don't like, and and then it just discourages me,
Yeah.
or a big client doesn't come through, or something goes wrong operationally. It's times like those that I've felt like quitting.
It's got to be a tough balance because on one hand, you want to take the advice of people that
Yes.
are trusted and really have a lot of experience, but on the other hand, you have to have that sort of single-minded approach of, I know what I'm doing, I know this can work, I just got to stay the course. So I'm sure that there's a lot of balance between that.
There is, and it's getting talked about a lot more in startup circles about founder depression or depression in entrepreneurial circles.
Yeah.
And there's a lot of depression that has always been there, I think, and it's because of these ups and downs. Like one day you're like your name is in Forbes, you've never been in
Right.
Forbes or TechCrunch, or Fast Company before, and the next day you can't make your payroll. It's
Right.
it's
Right.
very stressful sometimes. And it's those ups and downs, I think, that cause sometimes the idea of quitting to enter
Right.
your mind.
What do you want out of all of this? I think entrepreneurs get into, the entrepreneurs that don't succeed, to me, always seem like the people that get into it for the wrong reason. They're doing it just for money, or just for fame, or just, to be talked about and to be able to be seen as an entrepreneur. What do you want out of all of this? What's the big mission here for Retrace and for yourself?
There's two missions for Retrace Health. The primary one is to create a place where I want to work and where other people want to work, and they can reach their full potential. Like if that doesn't happen, but we solve healthcare, I'll consider it a failure. So that has to happen. But in regards to what the company will affect on the world, it's justice that I'm seeking. I see it as a huge injustice that healthcare runs and operates the way it does today. And if you really break down healthcare and the economics and the policies and come to a deep understanding of how it's impacting our country, you'll see that this is a serious issue. Just like many of the other, just like hunger, just like poverty, healthcare is a problem that we need to solve before it's too late.
Great. So, we good? All right. So, my last question will be, we have some entrepreneurs in the room. What advice do you have for other entrepreneurs in the room? Are there, one or two or three things that you would like to leave everybody with, just as they're thinking about, their own journey and where they want to go with their career?
Ideas are a dime a dozen. Everybody has an idea. So many people email me or call me and want to talk about their business idea, right? And I think the most important thing is to start and to not stop. Because things aren't going to go right. Things will inevitably go wrong. There will be days where you have a bunch of data that says you should stop, and you have to keep on going no matter what. And starting and not stopping are the critical elements, I think, for any entrepreneur.
Great. Any questions from the field before we let Thompson go? Yep.
So there definitely has been pushback, and I was actually going to use this in this answer to the last question, that one of my advisors taught me that you have to have an enemy. Like you have to have someone who fails because you succeed. I don't believe in win-win situations. I believe in fixed pies. And insurance companies are my friend, actually. Insurance companies are not the evil ones when it comes to healthcare. And, this is being recorded, and I've said this before in public, but it's the medical provider establishment is the main problem. And that's where the money's flowing. If you think about it, health insurance companies, their margins are fixed by the federal government as part of the ACA. So whether they make 20% on $1 million or $1 billion doesn't make any difference to them. But medical providers, it's like a black hole. So they push back a lot. And I've met with many healthcare executives, and invariably they all tell me that philosophically they believe in what I'm doing, and they like what I'm doing, and they know what I'm doing is right. but from a business perspective, they can't support it. Like they literally say that to my face, and it's classic Clayton Christensen, strategies.
Anybody else? Okay, great. Oh, you have a question.
You mean, how did I convince them? The question was, how did I hire people without any financial backing? So you're asking, how did I convince them, or how did I pay them? It was selling them on the mission of the company, and a vision, and being able to articulate that. And these were people that were already searching for something. They're already looking for something different. And I happened to have something that mimicked what they were looking for. So I don't think it was difficult to convince them to join me. But when it comes to the money part, I got very lucky. So after my second startup failed, I got a consulting gig at a company in Minneapolis, and I charged them a ridiculous and absurd hourly rate, more than I needed. And then they wanted to start giving me more work and have me work with some of their people. And I was like, well, how about I bring in some of my own people instead? So they were like, okay. So I brought in 2 guys that I billed out at an equally ridiculous rate. And I used those funds to start the company. But of course, those early hires, I mean, they're making like half of their market rate as well.
Anybody else? Okay. Thanks, Thompson.
Yeah, thank you.
Appreciate it. Yeah.